Madam Speaker, I'd like to spend a few minutes this morning discussing the recent report of the Commission to End Child Abuse and Neglect Fatalities. Chartered by Congress under the Protect Our Kids Act of 2013, the Commission's goal is to provide a framework for ending child maltreatment fatalities in the United States. For 2 years, they've studied and examined this problem, and now we have the results. The death of any child is a tragedy. While the data on child deaths related to abuse and neglect is incomplete, the Commission estimates that there were over 1,500 such cases in 2014. The majority of the children in these heartbreaking cases were younger than a year old, and many of them only days or weeks into their young lives. 3/4 of the deaths occurred in children under age 3. Madam Speaker, these are shocking figures, but we're talking about much more than just numbers. These stories of lives cut short, of senseless deaths, are a rallying cry for action, and no community or state is immune. In my home state of Rhode Island, at least 4 children have died in state care since last October, 2 of them infants. In neighboring Massachusetts, Bella Bond's story is a heartbreaking of our moral obligation to act in defense of all children. Bella only ever knew abuse and neglect. She died before her 3rd birthday, allegedly beaten to death by her drug-addicted parents. Despite 2 neglect complaints against Bella's mother, there was never any recognition that this toddler's life was in danger. The state never sent anybody to check on her safety, and her death remained hidden until her body was discovered. The problems in the Bella Bond murder, though sadly, are not unique. The Commission's report highlights a lack of communication between state child welfare agencies and law enforcement in every state. Noting the high correlation between domestic violence and child deaths, the Commission recommends that states treat this as a broad public health issue and call for better coordination between child welfare agencies and law enforcement. Because cross-agency collaboration will allow social workers to use law enforcement data to find the most at-risk children and intervene when necessary to protect the child. Just as we would take action to stop disease before it kills the patient, we can and we must intervene when a child's life is at risk. However, the Commission also notes that the most successful interventions are the ones that prevent a crisis from happening in the first place. Not all of these interventions involve foster care or removing a child. Early intervention of the most at-risk families will allow social workers to tailor and deliver the most effective interventions for each family. And even sometimes small interventions early on can make the biggest difference. The report makes clear that crisis breeds crisis. It is a self-perpetuating, repetitive cycle. Parents suffering from mental health issues or drug addiction are much more likely to harm or the stresses of unemployment and poverty are also linked with child abuse, neglect, and death. Madam Speaker, states need to engage in an all-of-the-above approach to child safety. We must also ensure that funding is in place to allow for meaningful interventions. Child welfare agencies need to be held accountable for results and empowered to deliver services and interventions to at-risk children and families when they're required. Despite these challenges, I would like to close on a hopeful note embodied in the title of the report itself, Within Our Reach. Madam Speaker, we can put a stop to these tragic deaths. Law enforcement, child welfare, and community groups have to work together to provide a network of support and intervention for families and children at risk of abuse. And we in Congress have to fully fund these agencies and empower them to deliver meaningful change. Madam Speaker, the time to act is now, and I yield back the balance of my time.